Good afternoon, everybody. My name is Tara Fries. I am a licensed clinical social worker at the Outpatient Behavioral Health Unit at Mountainside Medical Center. And this afternoon, I wanted to talk to you all about the impact of COVID on depression and isolation within children. So we're going to talk today about a few different subjects. We're going to start with the COVID world. Then we're going to move on to the signs of depression and isolation. I'm going to talk to you a little bit about what you can do, starting with you, ways to help your child, offer some conversation starters, a list of joyful activities, and then what to do if your child is still struggling. And then finally, I'll leave you with a list of resources that you can take with you. So where we're going to start today is the COVID world. So over the past 8 months, we've been living with fear, grief, and uncertainty. Overnight, our lives have dramatically changed. And our area specifically, Essex County, was one of the hardest hit counties in New Jersey throughout spring 2020. And as of October, cases are once again on the rise. So what does this mean? So as we've been experiencing COVID over the last 8 months, we've also seen that, according to the CDC, rates of depression and anxiety in adults specifically have tripled in 2020 compared to the rates of last year. In research around the world, it's being conducted as we speak. Really looking at the impact of COVID on how it's impacted children, specifically within depression and isolation. There was one study that was performed in China earlier in the year, in spring 2020, where they looked at and they surveyed children that had been quarantined for about a little over 30 days, and they measured the levels of their depression and anxiety. 23% of them were found to be depressed, and 19% of them were found to be anxious. And those levels were determined to be much higher than what they would normally have been. And what that indicated was that the loss in activity and connectedness by being quarantined has a direct impact on a child's mental health. I'm sure as we progress through the year, we're going to see a lot more research come through and a lot more numbers come through here in the United States as well. So how does the COVID virus impact your child, their mental health, and behaviorally? What are you seeing at home? So we know that some children are constantly worrying about getting sick. They're hearing about it, they're seeing it on TV. So this is a constant message that they're getting in the home, outside of the home. They may have had a loss, somebody within the family, a friend, a neighbor. So it may have actually hit close to home and had an actual loss, an actual death, or experienced somebody having been sick, having been hospitalized, and just everything that goes along with that. Your child has had to experience new routines in school. They might be fully remote, they might be hybrid. There's all sorts of different ways that they may be in school at this time, as well as in public. When they're at stores, they have to wear masks, they may have to walk in a certain way or walk out a certain way. So just really basic things that we sort of take for granted day to day. Our children are also experiencing this in their sort of their little bodies and their little minds. They're also being impacted just when they're home for remote school. Some children may not have the physical space, the setup, even the technology for remote school. So, not every child has their own, clean, neat desk with a chair, with proper lighting, with a proper, computer and space. There may be distractions in the house. You may have other people working from home. There's there's phone, there's computers, there's electronics, there's all sorts of things that can be distracting. So, for some people, for a lot of people, being at home may not be the ideal setup for learning for these kids. The inability to see friends and family whenever they want to. Some of their sports and their extracurricular activities may be limited. They may have stopped, restarted, or they may have special, rules that go along with it. There may be limited people on certain teams. They may have to wear masks. So again, different routine, different rules. And then there's, feeling left out if others are socializing. So especially for the older kids, if they're on social media, and if in your family you really are trying to limit the socialization and the kids are seeing other kids going out, they might feel left out and feel like they're missing out on, even if it's not a special event, even if it's just hanging out with their friends and they're seeing other kids do it on social media, that can feel really bad for especially the older kids. So what should you be looking for as a parent or a caregiver of a child? These are some signs of depression and isolative behavior. And these are general signs of depression that we look for when we're looking at children and adults as well. So feeling sad or hopeless, and that could be, just, tearful, crying, feeling like nothing's ever going to change, irritable mood, a lack of joy. So you never see your child smiling, they're never laughing, they always seem just sort of a flat affect, low motivation. So they really just, it's hard to get them going. It's hard to get them doing anything really to sort of get them up and moving around. Difficulty focusing or concentrating. So they, hard for them to read, hard for them to sit through a movie. For them, change in energy level. So they're very restless and they're constantly sort of fidgeting, or even pacing around, or they're very sluggish on the other end. They're just not moving very well, moving very much. Self-harm is another one. So if you notice, particularly with the teenagers, you notice any kind of self-harm on their arms, on their legs, they're cutting, they're using any type of sharp object to make, they could be making lines on their arms, and it's not necessarily a suicide attempt. Sometimes it's just, they're just cutting. And then the last sign of depression could be a change in eating or sleeping pattern. So they're eating a lot of food, or they're not eating at all. They're sleeping a ton, or they're not sleeping at all. And it's really, again, it's based on your child and knowing your child. If your child doesn't require a lot of sleep and then suddenly is sleeping 12 hours a day, that's a difference in their sleeping pattern that you should take note of. Okay, so those are some general signs. So and I wanted to just kind of break it down. If you have sort of younger kids and you have teenage kids, the signs of depression might look slightly different based on their age group. So both groups, elementary aged kids and teenage kids, may have what's called somatic complaints. So what that is really, my stomach hurts, or I feel sick, I feel like I'm going to throw up, or I have a headache. And that's not just, one time I have a headache, but we're talking every day, all day long. And what I would say is with somatic complaints, first you obviously want to rule out anything medical. So make sure that they aren't obviously sick. They're not, they don't have some kind of a virus or flu or whatever. And if it's not anything medical and they continue to complain about these physical ailments that are, are troubling them, but aren't really linked to anything medical, that can be a sign of anxiety, depression. Um, so in the younger kids, when you're looking at the K through 6th grade kids, regressive behavior. So what that looks like is bedwetting, sucking their thumb again, behaviors that they maybe used to do maybe when they were toddlers, 2, 3 years old, and now that they're in elementary school, they've kind of stopped those behaviors. Maybe if there's a younger sibling in the house and they start playing with their toys, which isn't necessarily an issue, but if you're seeing it where they're doing it for extended periods of time and they're only playing with the younger child's toys, it's just something to sort of notice. Angry outbursts, tantrums, and obviously nightmares. With teenagers, it might look a little bit different with them. Again, the somatic complaints, frequent mood shifts. Again, with teenagers, you may see some of that just as, them being a teenager, but this is, what you want to notice is the intensity and sort of the frequency of it. Are the mood shifts happening all day, every day, sort of for weeks at a time? We sort of expect that teenagers are going to have some kind of, moodiness at times. But if this is sort of happening, hours at a time, you're seeing it, and then it's sort of happening all day long, and then you're seeing it happen for weeks at a time. That's different. You may see with teenagers grief, which can also be sort of masked with some anger. So they're always angry. And that could really underneath be some grief, and it could be related to, if you have a senior and they're not able to have a graduation party, or if they're a junior and they're not going to be able to have prom. So these are things, for them, that's their biggest, in their life, that's their biggest thing that they've looked forward to. So for them to miss it, it's a really big deal. Obviously a decline in grades, and impulsive and risky behavior. And again, with that, I would say, teenagers can tend to make some poor choices. But I would say when they're making poor choices that are really sort of big, if they're walking out the door and it's 30 degrees and they're wearing shorts, that's not a great choice, but that I wouldn't classify that as a big deal. If they're, continuing to make really poor choices one after another that are sort of dangerous to themselves, then that's something to be a little bit more concerned about. So moving on to the next slide. So the next slide has to do with risk factors that can actually increase the depression. So these are things that could be happening within the home, that are happening maybe with the parents, maybe with older siblings, and that are just reasons or factors that can actually make depression more likely to happen. So obviously a loss of a job, if there's no income coming in, financial instability. A lot of people we know are, have lost their job during this time, and it's a really difficult time economically. Obviously, if there's any kind of physical, emotional, or sexual abuse that's happening currently or has happened, this is going to increase the probability that there's some depression with a child that's experienced the abuse or witnessed the abuse. If there is co-occurring mental illness, so if your child maybe has, a co-occurring, if they have ADHD, if they have autism, if anybody else in the family, if a parent perhaps has bipolar, or somebody else in the family, those things can sort of add to sort of the instability in the house and make it a little bit more difficult and increase the risk factors for the depression. And then finally, drug or alcohol abuse. So if that's happening in the house, if mom or dad or an older sibling possibly is actively using drugs or alcohol, those are things that will, again, increase the risk factors for depression within your child and within the family, really. So what can you do about all of this? Because this can feel really overwhelming. So what I would say is the first thing, we start with you, okay? You as the parent. Um, and I'm assuming, you know, who's listening to this is a parent, maybe a caregiver of a child, but you as the person that is taking care of the child underneath you. You need to focus on you first, to ensure that you are okay to take care of this child, no matter how old the child is. So that entails practicing self-care. And how do you do that? So I would start with eating healthy, sleeping, exercise. If you had to pick any of these, like one of these, I would say sleep is probably the most important thing you could do for yourself. So getting 8 hours of sleep, if that is possible. I know sometimes that's not possible at all, but getting sleep is going to help you probably the most, and help with your mood, help with your thinking, and just help overall with your stamina. Sticking to a routine that also sort of goes along with the sleep. So having a bedtime time, having a wake up time, particularly the Monday through Friday days, the weekdays when people are in school, if people are working, trying to really have a structure, because especially if people are home more, if they're homeschool, if there's remote schooling, trying to make sure that there's structure and a routine is going to help prevent chaos in the house, really. So trying to really stick to a routine. Maintaining healthy boundaries. So what does that mean? That means learning how to say no and not feeling bad about it. So being able to say no to your kids if you need to, being able to say no to your friend who drains you, taking care of yourself and saying no and not being afraid to say no, this is too much. Okay. Practicing mindfulness. So um, this could be relaxation. This could be every morning you take 5 minutes, you journal, you take a little, you drink your coffee, you journal in the morning or at night, before you go to sleep. Um, there are a ton of different mindfulness activities that you can do. I mean, even adult coloring is considered mindfulness. But these are practices that help teach you to sort of ground yourself. Yoga is another practice of mindfulness. The thing with mindfulness is you can do it for 3 minutes, 5 minutes. It doesn't take that long, and it's like a little mini mental exercise, but it kind of helps to center you, and then you can sort of move on with your day. And it is a really helpful way to sort of keep yourself from getting too anxious and letting things sort of unravel you. So I definitely encourage you, if there's guided meditations online, there's apps for them. They're really great. Try them out. They're free. You can listen to them in the car, at home. But there's a ton of different resources for mindfulness that are really, it's whatever works for you, whatever connects for you. Limiting substance abuse. So I'm not saying don't drink your wine. I'm saying limit it. I'm saying moderation, and I'm saying be aware of how often you're drinking, if it's drinking, and how you're doing it. So, that's all I'm going to say. Um, it's this is a really difficult time, so if you need to have a glass of wine every once in a while, I would not say don't do it. I'm just saying just be aware of how often and how much you're drinking, if you're drinking. And then lastly, find a therapist. Having somebody just for you, 45 minutes, an hour a week, to be able to unload your, a safe space to be able to unload everything, to process, it can be invaluable. So I recommend, if you have the means to do it, there's plenty of therapists out there. They can do it on video. You don't have to come in physically. And it's a really great way to really feel like you have, support for yourself. Okay, so the next slide is, so that was all about how to help you as the parent or caregiver. This is really how can you help your child, right? The biggest thing you can do is listen to them. That's the biggest thing I can tell you. Listen. Don't talk, just listen, right? Just hear what they're saying. Don't interrupt them, just listen to what they're saying. Hear them. Try to put yourself in their position, in their head, try to hear what they're trying to say from their perspective. That's the best thing. That's the best advice I can give you for them, because probably 90% of the time kids will say, my parents didn't listen. I tried to tell them, I tried to talk to them, and they're just not listening to me. So really sitting back, being quiet, and just letting them talk to you if they will talk to you. Second thing is provide perspective and hope. So our kids haven't been, they haven't been around for 9/11. They haven't been around for some of the things that maybe we've witnessed as adults. So having them understand that this will pass, COVID will pass, everything is going to be okay at some point. So let them know that this is temporary, we will get through this. And we've been through hard times before and we've gotten through them. Using open-ended conversation starters. The next slide will give you some ideas on how to do that. Turn off the news. So the news is, talking about either COVID or the election. I just think if you can try to turn the news off while your kids are present, so that they're not absorbing it, because even if they're not sitting in front of the TV listening to it, and it's in the background, they still get some of it. And it is very anxiety producing for them, and it can make them feel very helpless when they hear that being sort of talked at them, all those, everything about the news, about what's happening out there, and they have no way of doing anything about it. Contact the school social worker. So I would encourage you, if your child is having any issues school-wise, grade-wise, email your teachers, email the social worker. If you feel like your child is depressed and isolated and not connecting with any peers at all, contact the social worker, see what they can do, see if there's a peer group that they can set up. Right? If they can't do that, then if you're on Facebook or any kind of social media, try to connect with other moms or parents or caregivers in your kid's class, in their grade. Try to set up some type of chat group, especially for the younger kids that aren't, they may not be able to do that, but you can organize that so that maybe they have it's almost like a play date on Zoom or something every Thursday, something like that, where you can sort of organize it yourself and with the other parents. So that way you feel like you have some control also with the kids, with their peers. That's easier, I think, with the younger children. With the older children, it's a little bit more difficult. And again, the school social workers may have some peer groups. They do that when the kids are in school. They do a lot of peer modeling. So there may be things that you may not be aware that are happening that they can suggest for you to connect your child with other peers within school, but all virtually so that it's safe. For the younger kids, you might want to read a book on depression or loneliness. That can stimulate some conversation with them. They may not have the words, the language to be able to say, hey, mom, dad, uncle, I'm feeling really bad, I'm sad, I'm lonely. They just may not have the words to articulate it. So sometimes when you read, sometimes when you color or draw pictures, they're able to even point at things easier and draw faces. That can help them with expressing themselves. That's a little bit, it's more about relates more to the younger children than the older children. But even the older children still may have trouble sometimes being able to verbalize what they're actually feeling. So so don't be afraid to try to kind of help them find the words, because sometimes, even as adults, we have trouble finding the words to express what we're truly feeling. Um, and then finally, just play and have fun. I mean, laughter and fun is like medicine, a good medicine. So I encourage that, to try as much as you can to kind of take a break and cut through all this awful stuff and really try to have some fun with your kids. So we'll move on to the conversation starters. Um, these are just some examples. You can completely modify these to what's comfortable for you. I mean, this is not a scripter by any means, but just sort of ways to kind of begin the conversation. If you feel like there's still your child is, worried, concerned about COVID, and they may have questions still. I mean, we assume sometimes that they know what's really happening, and they may not. So, it's confusing. Do you have questions about COVID? I may not know the answer, because you may not know the answer, but we can look at it we can search, we can Google something together. What is your biggest worry about COVID? Again, sometimes we assume we think we know what that your child is most worried about, and it may be completely different than what, what we think. So trying to just open it up, without assuming or putting our projecting our feelings onto them. Okay. I'm going to move along. This is just a list of joyful activities that you can go through at your leisure. And hopefully it's something that, maybe you can pick a few that might sound fun to you or interesting. The one thing that, I've done, with, as a Girl Scout leader, we've done the virtual sleepover, which was really fun. And it sort of goes back to almost like having a play date, but you do it sort of online. So it's a safe way to have the kids connect, but they're within their own home. Having things that the kids can look forward to on a weekly basis is also a really nice thing. So whether it's having a weekly theme night or a weekly dinner type, like a different, Italian one night or 1 week, or, or a Sunday movie night, things that they can look forward to that provide some consistency for them, is a really important thing. So just some ideas. What making cards for nursing home residents or grocery store workers or something like that. Doing any type of volunteer work. It's going to be hard because your kids can't really go into places. But you can always make a card and drop them off, and people, having your child do something helps them have a sense of control, and it makes them feel good. So any kind of sort of, altruistic activity like that is a really nice thing, and I think it's a nice project to give to, have your kids work on. So what do you do if you've tried all these things? You've tried to talk to them, your child is still really struggling, your child is, shutting down, not talking to you. You've tried to do fun things with them and they're just not really engaging with you, and you're getting really nervous and you're feeling like your child is just sort of is just sort of detaching and getting, is just sort of shutting down from, their normal behavior. And you're worried that maybe they're feeling hopeless, and even, your worst fear is, they're thinking about, suicide, which, sadly, that's, it's of course any parent's worst fear. So, what do you do if that's the case? If you're in a situation where you're starting to feel really worried about it? So here are some ways that you can address your child, and I would say go to them, talk to them about their feelings. And again, it goes back to listening. Listen to what they're saying to you, hear what they're saying, and ask your child very direct questions. Are you thinking about hurting yourself? Are you thinking about suicide? If they say yes, yeah, mom or dad or uncle, or I've thought about it. I don't think I can do this anymore. Okay, what have you thought about? What are have you planned anything? Have you thought about how you would do it? Have you researched it? Ask them very specific questions, because you want to sort of get a sense of um, how sort of far along are they in this process? Have they been on the internet looking? Have they written a suicide note? Um, so you need to ask these really hard questions. um, you do need to make sure you tell them and you show them how important they are to you. So, telling them how much you love them and showing them, a hug can go a really long way for somebody who's in a lot of pain. Taking passive suicidal ideation seriously. So, some kids and some people say I don't they'll say things like I don't want to wake up, or I just want to make the pain stop, or these things that are sort of we would call it a passive suicidal ideation, or so it's not like I'm going to kill myself or I just want to die. It's more of a passive statement. um, but you need to take those seriously because you don't know. And if they're saying something like that, it's a flag. It's an indication that they're in pain and something is going on, and you don't want to take a chance. So you can't ignore statements like that, even if it's not a direct statement saying, I want to die. If it's a little bit more vague, but it's still concerning. And if and all after saying all this, if you're feeling concerned, if your child is saying, I'm having these thoughts, and you're just not, if you're not sure what to do, bring your child in and have your child evaluated. Have somebody neutral evaluate your child, and then it sort of takes it off you so that you don't have to make the decision, because there's tons of people that are trained to evaluate a child to decide whether or not they need to be in the hospital. Avoid being dismissive, oh, stop saying those things, or oh, it's not that bad, don't worry about it. Avoid lecturing, avoid using judgmental or condescending tones, and avoid saying like you shouldn't say that, you should never say that. Trying to be more positive. um, it's a very scary subject for a parent, so trying to manage your anxiety when you think about this. But I would say always go back to, if you're sort of wrapped in this and you're so worried and you really feel like your child is having these thoughts, have your child evaluated, and then at least you have somebody um, that's neutral and professional that can talk to your child and really make the decision for you about what to do next. So here at Mountainside Hospital, we have a treatment team that can service a lot of your psychiatric needs. We do have a crisis department in the emergency room. So if you come, if for some reason you were in crisis, you were feeling suicidal, you were having some kind of episode, you needed to come in, we do have crisis counselors that are down in the ER. We do have an inpatient unit that offers beds for adults 18 and over, and it goes all the way up to a geriatric unit. And then once you are discharged from the inpatient unit, if you were on there, we offer outpatient services as well. So we offer an intensive outpatient program, which is 3 days a week, 3 hours a day, where you would get therapy and psychoeducation, and that's for adults only 18 and over. And then we also offer outpatient therapy. So that's just one-to-one talking, individual therapy, or we can do some family therapy as well. And that's the outpatient therapy is for children and adults. So we do service, 18 and over, but we also service children as well. And all of the outpatient programs have therapists like me and also doctors. We have psychiatrists and we have an APN who prescribe medication on staff. So if you need any outpatient services, call Ed Petrarca, and he can help you to set up an intake appointment. And then finally, resources, mobile crisis. So if you feel like your child is suicidal, or somebody in anybody, it doesn't have to be your child, but anybody within your family, you can call mobile crisis. They will send somebody, they're called a screener. They will come to your house. They will screen your child if it's an adult, decide whether or not the person needs to come to the hospital. Okay, so that's a good phone number to keep on hand if you feel like, somebody might need that in your house. The suicide hotline, that's to give to your child or anybody in your house if they're feeling very depressed and they want to talk, and they're having suicidal thoughts. The crisis text line, that's a really great one for your teenager. If your teenager doesn't want to talk, they can just text somebody. It's 24/7, it's free. The warm line it's not if you're suicidal, it's just if you want to talk to somebody, and they have more limited hours. And then finally, the New Jersey Children's System Perform Care. So that's really, it's a comprehensive website that has information through the state for kids, for school, for housing, food. It has a ton of stuff on there. So it really has a lot of information for, children, families, school-related housing, and everything. So that's my presentation. I hope you enjoyed it. I hope it was helpful. I think there was one question. I want to just see. There was a question earlier, I believe, about how do I manage older kids while I'm at work? Oh, that is such a good question. That is such a good question. That's a great question. So I think this is an issue for a lot of people. And I think that the first thing is what you can do is, what I would say is, you need to reach out to your the social worker, teachers at school, and see if there's anything they can do, they can recommend. Sometimes they're willing to send emails to help remind the kids, like if the concern is, are your kids not getting onto their Zoom classes or something like that? A lot of times the teachers are willing to send reminders in the morning. They'll send emails. So I would first enlist the school's help to see what they're willing to do, if anything. Obviously, if you can set any type of reminder, alarms, anything, it's hard. I mean, I don't know that I have a really perfect answer, because I think we're all struggling with the same, a similar issue. Another option, I think, though, is, maybe trying to set up some type of a reward system. I'm assuming the child is a little bit older, maybe like a teenager. So maybe there's some type of a reward system that you can set up that, if they go to every class, they will get X. whatever it is, whatever their currency is. And that's important for you to know. So if it's money, if they want money, or if they want, some kids, like, depending on their age, they might want, I don't know, something on their video game or candy or whatever it is that is important to them. That's not going to break the bank, obviously, but that will incent them, that will motivate them. You can set up something to kind of help. It's almost like a behavior chart that will help motivate your child to attend and do the things that they need to do. Not easy though. I think you have to try try different things and see what works. I think the punishing is probably not the way to go. I think if you can try to motivate them to do it on their own and really try to empower them to do it, that's a better approach for them too. So I hope that was helpful. And I thank you. I thank you for your time. I thank you for your attention.